Okay, thank you everyone. Welcome to the International Youth Day 2025 webinar and happy International Youth Day to you all. My name is Salaam Mosha and I am the co-moderator alongside Gideon Gachichi, who will moderate the main session. So I will just give an overview of our webinar today. We are meeting here today under the theme Local Youth Actions for the SDGs and Beyond. Harnessing the demographic dividends, investing in youth, SRHR, and mental health for a sustainable future. As we all know that with over 65% of our region's population under 30 are the young people and are not the leaders, and they are not the leaders of tomorrow. They are shaping the change of today. So by this demographic, potential can only be realized through strategic investment in sexual and reproductive health, but also the angle of mental health. These are the two essential pillars for sustainable development, I can say. So today we are here to celebrate the youth innovations, to share lessons from across countries, also to build momentum towards the Continental Youth Health Summit that will happen in November. We will hear more about that later. So thank you all for joining us. Continue sharing the link. I am honored to invite the first speaker who will provide the welcoming remarks, who is none other than the Director General for ECSA Health Community. Before we continue, I would like to read a short biography of Dr. Ntuli Kapologwe, who is the Director of the East Central and Southern Africa Health Community, a regional intergovernmental organization composed of 9 member states committed to advancing health development across the region. With over 2 decades of experience in health system management, policy financing, and public health, Dr. Ntuli Kapologwe is a highly accomplished leader and a health strategist. He holds a medical doctor degree from the University of Dar es Salaam, a Master's of Public Health from Tumaini University, and a PhD in Public Health from the University of Dodoma. His international credentials includes an MBA in International Health Management from the Swiss Tropical and Public Health Institute, a postgraduate diploma in strategic leadership from Aalto University, Finland, and the Uongozi Institute, Tanzania, and a certificate in public health leadership from the University of Washington, USA. So, yeah, welcome, Dr. Ntuli Kapologwe, for your welcome remarks. Thank you.
Thank you very much, and indeed it's such a privilege and it's an honor for me to talk to you this evening to the very, very important topic in our continent, but also in the ECSA region. First and foremost, my sincere thanks to Dr. Hagos from Auda Nepad, my friend Dr. Francisca Bwalia from Zambia, my friend Gideon from Kenya, without forgetting my sister Christine Mugo from Kenya, who is representing the ECHO. So today's topic has arrived at such an opportune time because we'll be discussing the 2 very important topics as far as the young people is concerned. Africa is a home to 65% population who are youth, out of 1.5 billion people who are residing in the continent. But also Africa is the region or the continent that is facing a number of challenges that are facing the youth, especially around the sexual and reproductive health and rights, but also in the area of mental health and well-being. When it comes to the accessing sexual and reproductive services, only 28% they can access sexual and reproductive health. When it comes to the issues of mental health, out of 100 youth in the continent of Africa, only 10 can access mental health services. However, we all know that 1 in every 7 youth is having a mental health challenges. And one of the challenges that they do experience is we have from depression to anxiety to psychosis. So today's topic is one of very, very important if we are to harness demographic dividend. Demographic dividend means investing in the young ones, in the youth, in the adolescent, for us to be able to appreciate the development in the future. So for you to be able to arrive to that, we really need to talk openly about the sexual and reproductive health and rights, but also we need to talk openly about issues around mental health, because these two areas are the ones who, in one way or another, affects the human capital of any country. ECSA being a home to 9 member states, although its activities spans in 30 countries, we find it is very imperative for us to make sure that we discuss these issues openly. That's why we are very happy today in our panel, having colleagues from Mauritius sitting in the panel to discuss about this, having colleagues from Kenya, from Zambia, but having Auda Nepal as our key and strategic partner. So I believe today is going to be the day where people, they will get to speak these issues, and we as ECSA, our responsibility will be to make sure that we aggregate all the deliverables and discussions that emanates from today's gathering, and then we forward to the next level, because ECSA works within a very organized governance structure that allows to facilitate different dialogues before it goes to the supreme body, which is the Health Ministers Conference. So whatever we are going to be discussing today, resolutions that are going to be made is our responsibility to aggregate them and forward them up to the Health Ministers Conference so that they can be taken to the member states. Not only that, whatever is going to be discussed here is going to be forwarded to the African Union, to the WHO, and other regional and global health bodies for a discussion. So I'm very much delighted, and I really look forward to having good and candid deliberations. On that note, I declare this meeting opened, and I wish every one of us to have a very good meeting. Thank you.
Thank you very much, Dr. Ntuli, for those insightful and inspiring words, and also for reminding us why youth investment is not just important, but it's urgent. Thank you very much. Okay, before we move to our next session, I would like to introduce the main session, the panelists, which will be moderated by Gideon Gachihi. But before that, I would like to read biography of some of our panelists, starting with Dr. Hagos G. Davis. He's a program head for Africa Demographic Dividend and Sexual Reproductive Health Program at AUDA, NEPAD. Welcome, Dr. Hagos. But also we have Dr. Francisca Biala Chama. She's a consultant psychiatric. She lectures and practices clinical psychiatric and mental health. She holds a master's in medicine, in psychiatry from the University of Zambia, and a postgraduate diploma in clinical psychiatry from the University of South Wales. But also she's passionate about helping people live productive and high-quality lives. She leads several mental health programs and policy formulations in both public and private sectors. She collaborates with NGOs to raise awareness and reduce the stigma around mental health. Dr. Chama also has played a key role in developing national treatment guidelines and enhancing access to care by building the capacity of health personnel. She also serves as the director of psychiatry for the specialist training program under ZACOMS, and as the national mental health coordinator as the Minister of Health, Zambia. Welcome, Dr. Francis. We also have Thabo Mokothu. He's a medical superintendent at Moflomi. Excuse me if I'm pronouncing wrong. The words are kind of Lesotho accent. Okay, he's a psychiatric, as the Moflomi is a psychiatric hospital, and he's practicing as acting director, mental health, Minister of Health Lesotho, and also all around mental health advocates. He greatly emphasizes on wellness and mental health prevention and promotion. We also have Dr. Tavisha Bunju from Mauritius. She serves as a Sexual and Reproductive Health Coordinator as the Minister of Health and Wellness Mauritius, where she leads the design, implementation, and evaluation of national programs to advocate sexual and reproductive health, maternal health, and child well-being. A qualified medical doctor with a master's in public health, but also Dr. Guntz combines clinical experts with the public health leadership to drive evidence-based policies and improve service delivery. Her work focuses on strengthening health system, promoting equitable access to care, and aligning national strategies with regional and global commitment to a sustainable development goals. So those will be our panelists for today. And by saying that, I would like to welcome Gigi to continue with the session. Thank you.
Thank you so much, Salome, and thank you, DG, for the warm and also insightful opening remarks. So my name is Gideon. I'm also part of the Commonwealth Health Youth Network, and I just want to jump straight into the schedule or the program. So I want to invite Dr. Hagos to give his remarks, and I'm very curious with the wordings that Dr. Hagos you have in your organization, Africa Demographic Dividend. I want to hear from you why dividend as you share your remarks. Welcome, Dr. Hagos.
Okay, thank you so much, Gideon. Hello, everyone. Good evening. Distinguished participants, esteemed youth leaders, colleagues from ECSA, the Commonwealth Secretariat, ladies and gentlemen. It is both an honor and a privilege to join you today on behalf of the African Union Development Agency, ODA NEPAD, for this important commemoration of International Youth Day 2025 under compelling theme, Local Youth Actions for the SDGs and beyond. Let me begin by sincerely thanking the organizers, ECSA and the Commonwealth Secretariat for convening this vital conversation and, more importantly, for placing young people, Africa's greatest asset, at the center of the dialogue. At ODA NEPAD, we firmly believe that Africa's future not on the horizon, it's already here. The transformative power of our continent lies in the decisions we make today, especially those that concern our youth. This is not rhetoric, it's a development imperative. Africa is the youngest continent in the world, with over 60% of population under the age of 25. We are witnessing an extraordinary moment in history, one that holds the promise of unprecedented growth and innovation. However, let us be clear, the demographic dividend is not automatic. It is a window of opportunity. And like all windows, it will close if we don't act decisively. So this is opportunity. We must invest in all full spectrum of youth development, health, education, skills, livelihoods, and rights. We must create an enabling environment where young people are not passive recipients, but active architects of their futures and that of the continent. At Odanepad, this is exactly we view young people not as the beneficiaries of development, but as co-creators of Africa's transformation. Our initiatives, from supporting national youth strategies to strengthening integrated health systems, are all grounded in this belief. As Her Excellency Mr. Nisnardos Pekele Thomas, CEO of Audanepad, so powerfully stated, youth are partners, assets, and a prerequisite for sustainable development as well as for the peace and prosperity of Africa. They have a unique contribution to make to both our present and future development. Today's focus on sexual and reproductive health and rights and mental health is critical. These issues are too often marginalized, but let me emphasize, they are not side concerns, they are foundational investments. Comprehensive user-friendly SRH services are essential, not just for health outcomes, but for achieving gender equality, reducing maternal mortality, preventing gender-based violence, and promoting dignity and autonomy. Likewise, mental health must no longer remain in the shadows. From depression and anxiety to stress and trauma, our youth are experiencing complex mental health challenges, exacerbated by unemployment, conflict, climate change, and digital overload. Yet stigma, underfunding, and a lack of access persist. Let us unequivocal mental health is health. It must be integrated, prioritized, and destigmatized across all its development agendas. We cannot afford to stop at policy declarations. We must move boldly from commitment to implementation, and that action must be youth-led, locally grounded, and continentally aligned. To achieve this, we must ensure youth voices are not only heard but acted upon in governance and policy making. Youth-led organizations are financially and technically supported to deliver local solutions. Data and innovations are harnessed, leveraging digital tools to expand access to SRH and mental health services. And that multi-sectoral partnerships from government to civil societies and international partners are mobilized to scale what works. This webinar marks an important milestone as we prepare for the Continental Youth Summit on SRH and the demographic dividend to be held this November in Dar es Salaam, Tanzania. We commend ECSA and the Commonwealth Secretariat for facilitating national youth dialogue across 9 countries in preparation for this summit. Odanepad is proud to work alongside you, amplifying youth voices and supporting bold youth-led action for health, equity, and transformation. So to the young people joining us today, you are not the leaders of tomorrow. You are the leaders of today. Your ideas, your questions, your innovations, these are the building blocks of the Africa we are working to create. At Odanepad, we are committed to championing your rights, elevating your leadership, investing your potential. Let this International Youth Day not be merely a celebration. Let it be a catalyst for action, for bold policies, inclusive investments, and transformative partnerships that place youth at the heart of development. Together, let us shape a future where every young African can live with health, dignity, purpose, and pride. Thank you so much.
Wow. Thank you so much, Dr. Agus, for such insightful and very well-detailed remarks. We really appreciate hearing from you. I'm just noting down some of the key things that you mentioned, that indeed Africa has one of the youngest population, and indeed this young population is one of the greatest assets that it has. And also the emphasis you've made on having to put more investment in order to harness the demographic dividends of young people. So we really appreciate your remarks, and we really hope that you continue supporting us in moving, as you have stated, in moving the actions and the commitment, not just being things that we are voicing, but we also moving from action to implementation. And with that, allow me to invite our next panelist, who is Dr. Francisca, who is going to share with us a general overview of youth and mental health, and try to share with us how can we address the issues that have been raised by Dr. Hagos, the issues of integration, the issues of how we can destigmatize mental health within our society and within our community, so that we harness the demographic dividends from young people. Welcome, Dr. Francisca, and we are happy to have you today.
Good afternoon. Glad to be here this afternoon as well. Allow me to ride on the protocols that have already been established thus far. Youth and mental health. And I'd also love to, before I even get into my talk, I'd also love to just thank the ECSA community and the organizing committee for this platform. So youth and mental health. Youth and mental health is such a critical issue and conversation, because mental health is affecting the youth. And we heard Dr. Kapologwe mention the various statistics around Africa, how the region is mostly young, and the alarming statistics of the prevalence of mental health in the region. That those numbers, that data is speaking to us to be deliberate, to have interventions to prevent mental health presentations amongst the youth. And as we navigate these various challenges, we'll agree that it is essential to prioritize mental health amongst the youth, because it affects various outcomes of their lives, their relationships, their academic performance, and overall quality of life. And it affects their productivity in society as a whole. And if the larger population of our region are youths, and they're greatly affected by mental health, already we're seeing a large percentage of the population that is supposed to be productive, but may have reduced performance because of various mental health issues. And what are some of these common mental health issues that are presenting amongst the youths? Some to mention include anxiety, depression, and comorbidities related to substance use disorders. And of course, we can't speak of solutions about the youth without involving the youth. Inclusivity of the youth as we come up with solutions for the youth is another key aspect. Because one thing we have to appreciate is there are differences amongst generations, right? Intergenerational dialogues. Are we creating platforms for those discussion, for us to have a better understanding of what are the factors contributing to these mental health presentations amongst the youth? And further go to identify the risk factors. Investment in research to have an appreciation of these factors. Engaging the youth to give input to help us understand the nuances to the mental health presentations amongst the youth. We need to have these conversations. We need to invest in programming specifically for mental health amongst the youth. Very key as well to highlight is adverse childhood experiences. How are we investing? Because those are also a major contributor to mental health presentations later in life. How are we deliberate to identify them? Various areas of abuse. And what support system structures are we putting in place as a region to offer support to people who experience various adverse events in life, traumas in life, so that we prevent presentations of various mental health situations. So, as a society, we need to encourage the young people to speak up. What are their challenges? What are their struggles? How would they want us as a society, as a community, to come in to support them? Increase access to mental health services and resources that are youth friendly, which are specific to their need, to their youthfulness. Are we being deliberate about that? Youth friendly spaces, not only within the health facilities, but in schools, in community. Are we fostering a supportive and inclusive environment where the youths feel heard, where the youths can also contribute to policy, to solutions, to their needs and challenges or struggles? Are we building capacity? That's another great potential, because stigma is also a major area that's affecting presentation of individuals with mental health issues, and that is similar amongst the youth. Are we investing in awareness and sensitization around mental health? A lot of focus has been placed on physical health, though one cannot be said to be fully healthy if they are only physically well but are not mentally well. And also another important aspect that we need to appreciate is that the mental health can also affect one's physical health. Hence the need to also invest in the mental health and mental well-being of the youth. Are we building capacity amongst the youth for them to understand mental well-being? How promoting self-care and stress management techniques amongst the youth? Integrating mental health care and well-being in school curriculums or programs. That is a low-hanging fruit that we can definitely harness. How do we work together to improve mental well-being amongst the youth? Innovative solutions that are attractive to the youth, technology, social media, apps, easy accessible from wherever they are through their phone, telemedicine. How do we come together and invest in various resources to support the youth to improve their mental well-being, and especially improve access to the mental health support that they need? The youths have so much potential, so much energy, so many great ideas that could be used to improve the services that we offer the youth. I'll give an example of myself. I was a youth just a few months ago, and I was given this platform to coordinate mental health in the country as a youth. So there's a lot that the youth can do and contribute to society and to the solutions to improve mental health and well-being in our region. I love the idea of this platform, youth leading mental health programs, bringing various sectors from policy makers to technocrats to fellow youths to discuss around their well-being. What other platforms can we provide for the youth to facilitate or foster such discussions? there is potential. How do we build capacity amongst the youth to allow them thrive and be part of the solution? Train them on advocacy, train them on how to lobby, train them on how to convert their ideas into policy, train them how to apply for grants that can facilitate various activities, youth-led activities around mental health in the community, amongst peers, identify champions and artists or influencers that are able to get the attention of the youth, to have this conversation with the youth. There's so much that one can get by spending time with the youth. And there's a great wealth of knowledge amongst them. So let us continue to bring the youth to the table of discussion. Let us work together to create a region which has young people who feel empowered, who their mental health is prioritized, and let's give them the tools, the support, and the resources that they need to thrive. We can do this as a region. I think we have a great potential amongst ourselves. And I think another important potential is the youth themselves, various youth-led mental health programs. Let's prioritize mental health. Thank you.
Wow, thank you so much, Dr. Francisca, for that insightful remarks. We really appreciate hearing from you. Just to mention a few things that you have touched on, we appreciate the way you have been able to just show us the picture of the impact of not investing in mental health among the youth. And I like the way you have showed the direct impact in terms of the missed opportunity of this human capital, the likelihood of having a social instability if mental health is not addressed, the missed opportunity of economic productivity, and also the impact of mental health in the healthcare system. That if it's not addressed, it can actually have some dire ramifications. And I also like that you have given us a lot of suggestions and solutions that I think the panelists who are here, Dr. Ntuli and also Dr. Hagos, who sit in these high tables, might actually take heed of such suggestions and basically find a way to support, to continue supporting youths in creating awareness, advocating for creation of those youth-friendly space. Now, at this time, allow me to just change the program a bit so that we hear the response, because Dr. Francisca, you've mentioned a lot of how. You have raised a lot of questions that needs to be answered. And the hows, I think the best person to address those how is none other than Dr. Thambo Nkoto from Lesotho. Please, Dr. Thambo, share with us how is Lesotho addressing the challenge of mental health, and how are they using the cultural context to address the existing challenges and make youth mental health services more accessible, affordable, and even more friendly to them. So at this time, let me welcome Dr. Thambo. And for our listeners, continue jotting down all the questions you have for our panelists. We will have a 10 to 15 minutes session for question and answer. So for now, thank you so much, Dr. Francisca, and I wish to welcome Dr. Thambo. Welcome.
Afternoon, everyone.
Afternoon.
You keep butchering my name. I'm Dr. Thabo Mokgotu.
Yes, Thabo Mokgotu.
Thabo Mogotu, but it's fine. So I would like to also align myself with the protocol that has been observed. Thanking in particular the panelists, ECSA team, the NEPA team, the mental health experts and sexual reproductive health experts, all the panelists, the coordinators, and the participants at large. So I'll be presenting on youth mental health, the Lesotho perspective. So to give a country background, Lesotho is a country that's landlocked within South Africa completely. It has 10 districts. It serves a population of 2.4 million, with a youth population of the age between 10 to 24 at 31%, with a youth literacy rate of the population between 15 to 24 years at 89.3%, as per the census that was done in 2022. The key socio-cultural factors influencing youth mental health, poverty, unemployment, rising drug misuse. But of particular importance was alcohol and marijuana. We also had broken family structures, as we have many youth-led households. In terms of the current burden, the data was taken from Mahlomi Psychiatric Hospital. Of the clients that were seen from March last year to March this year, of which 65% are youth. Mood stabilizers, mood disorders, having been clustered together as depression, anxiety, and bipolar, given the data collection methods that were used, were found to be at 36%. Schizophrenic patients were at 18%, substance use was at 25%, of which 90% were youth. There's been a growing concern that Lesotho is number one in the suicidal rate in the world. However, we have not yet gotten the funding for the proposed suicide situation analysis that we are planning to do. We have a lot of data quality issues, especially from other mental health institutions outside of Maseru. However, what we have done as the program is we have piloted new mental health monitoring and evaluation tools to address the issue. We are also going to include the mental health indicators in the DHIS, which is the centralized data collection tool for the Ministry of Health. In terms of governance, Ministry of Health, with its mental health directorate, is responsible for all mental health service provision. As of this year, we are fortunate enough, after intense fights and advocacy, we got 0.01% of the budget as a program. In Lesotho, the mental health services are provided freely, including medications. Within the directorate, we have community department, which is tasked with mental health education, awareness, promotion at various places, including schools, rallies, radio slots, sporting events. We have a working relationship with other ministries, whereby we also offer mental health services and wellness, especially in the workplaces. Within the program, we have a mental health technical working group, which is inclusive of implementing partners like ECPAF, PIH, Baylor. We also have a working collaboration with youth-focused partners like Sentebale and Reps Lesotho, which offer community psychosocial interventions. And we support the training of the service providers. I'm having an echo. I'm not sure. Am I still audible?
Yes, you're still audible. Sorry for that.
Okay. So in terms of how the mental health care group works, we have recently added the academia from the mental health training institutions like National University of Lesotho and National Training College of Nurses. This group is tasked mainly with the development of mental health guidelines and capacity building of all healthcare and non-healthcare workers. In terms of the policy and legal framework that we have recently, the cabinet has recently endorsed mental health policy and strategic plan that had been in play for the past 7 years without being endorsed. However, the policy and strategic plan are not age specific, but they allow for all of us to get quality services in terms of mental health. Last week, we started on the new mental health law, whereby it was very intentional to include other line ministries like Ministry of Education, Ministry of Youth, Ministry of Sports, so that we can see how we can have a framework within the law and the policy for youth mental health action plan to address issues that pertains to age of consent. At the moment, there's no standalone national youth mental health strategy. So in terms of Lesotho model of care, this was as a result of lack of expertise across all board. We have lack of consultants. So there was a great emphasis on integrated primary health care with the use of health centers and health posts. Within the structures of health centers, we have youth mentors, youth ambassadors, screeners, and retention officers who work hand in hand with the health center nursing staff. These cadres were implemented from HIV and TB programs. So we are just using the existing structures to offer mental health services. We are fortunate enough in that NGOs like ECPAF have hired psychologists and professional counselors for youth mental health within the communities. So the health centers do monthly outreach services to hard-to-reach areas. We have also introduced the mental health package within the outreach services, even though some of the health centers are still lagging behind. We have health center committees, which involve traditional leaders, school security agencies. They also liaise with social development for marginalized youth. We have an intact referral system that is in place and that is well aligned from when they encounter patients, having screened them in the communities up to when they get to tertiary level. So in terms of secondary, Lesotho has 18 district hospitals, government and child facilities run by the DHMTs, which are the decentralized district governing bodies, which also serve as a gateway to the communities. One cannot just go to a community without having gone through the DHMT offices. The HIV program that was supported by NGOs that we have sort of hijacked initiated adolescent corners, where they also hired adolescent-friendly human resources, including nurses. Within each district hospital, there is a clear linkage of services from and to adolescent centers to the mental health observation and treatment units, which are run by the psych nurses with the assistance of medical officers. In terms of tertiary level, we have one referral psychiatric hospital where I'm currently placed with one psychiatrist and 2 clinical psychologists. And therefore, as the program, we've had to capacitate all the health center, all the healthcare workers on issues of mental health, particularly on screening, to try and reduce the overload at the referral hospital. And therefore, we stress the importance of following the referral system strictly. However, at the hospital, we still need to incorporate telemedicine and knowledge exchange programs for each specific cases. Due to the concerning high numbers of addiction amongst the youth, we recently opened an OPD addiction care center within Mohlomi Psychiatric Hospital, where we are seeing that huge number of the youth as indicated. So in terms of community-based interventions, like I said previously, the aim of the Ministry of Health is to integrate mental health into already existing structures of care. We were fortunate enough in that after we consulted and involved the academia, they told us of a project that they had already started on their own, which is called Decolonized Mental Health Project, where they build capacity and knowledge and exchange knowledge between traditional leaders and spiritual practitioners. This has also allowed us to have referrals even from the spiritual and traditional practices. And therefore, we are able to care holistically for our clients. So we have a time project which is about to start. We are doing it with Stellenbosch Research, whereby we'll be using music and dance to tackle maternal mental health. We are already establishing a framework between mental and maternal health to see how best we can work going forward. We are fortunate enough to get assistance on training of security agencies, civil society organizations, and traditional leaders, teachers on addiction prevention and treatment as offered by ASUP. So in terms of government projects that we are a part of to tackle youth issues, in July, the Cabinet of Lesotho declared high rates of unemployment a national disaster at 30%. Among people aged between 15 and 35, it is 39%. That's an extremely high percentage. And that in its own leads to a lot of mental health issues coupled with substance use disorders. So the Prime Minister of Lesotho initiated what we call Sababatso Youth Empowerment Initiative. That is primarily for Lesotho youth entrepreneurs, where they are going to access funding, mentorship, and international opportunities. I think a month or so since we have not had a rehabilitation center for more than 10 years, and also to tackle the issue of unemployment, the cabinet then decided that each ministry is going to contribute 2% of its budget towards mental health programs so that we can establish the National Substance Rehabilitation Center, whereby we have a working relationship with one of the youth-led organization called NFIT. So we are going to be assisting them in curating the services within this fully functional rehab. But the main goal of this strategy is to ensure that even the workforce, we prioritize the youth. So in terms of the way forward, unfortunately, from the ECSA meeting that we had, we realized that there was no existing correlation and coordination between other ministries in terms of youth mental health. So what we need to do is to engage the different ministries that partake in the youth mental well-being and general well-being of the youth. So that includes Ministry of Youth, Gender and Social Development, Ministry of Tourism, Sports, Arts and Culture, Ministry of Education and Training, Ministry of Labor, to have forums with them so that we come up with a legal framework of engagement while awaiting a fully fledged youth mental health action plan. The other activity is to engage youth-led organizations. We have already identified a few with a few mental health advocates that I will share as we proceed. We also need a mental health program to be visible within the social media space to allow interaction of the youth who need to discuss mental health issues. We need to improve our data quality. We need to focus a lot on research and development. We need to also work with our regional neighbors, and I'm glad that this forum has a couple of them, to come up with regional youth mental health guidelines and knowledge exchange programs, particularly in helping the youth. So in terms of the affiliated organizations as of now, we have Tshwane Foundation, which is an NPO that is raising awareness through different media platforms, including podcasts. What's also nice about them is that they're offering free counseling sessions through different media. They also have WhatsApp media where clients can easily interact with the psychologist and get help. They also have skills training programs to also capacitate this youth on income generating avenues. We also have an affiliation with people with lived experiences, particularly addiction, as it pertains to the youth. Of note is that after the ECSA meeting, we had a discussion with Mekwena Diketso Mkhanso, who is also part of this platform. She's a youth mental health advocate, a social worker. So I think that shows that we are actually willing to do the work. So this is my last slide. So in terms of the principles that we want to hold on, because we want to focus mainly on prevention and mental health promotion and overall well-being of our population. That also includes the youth. So we have a concept called feminism. The hospital that I work at was named after Morana Mhlomi, who was a healer and a philosopher. I'm sure for people who appreciate history, they can go and find out about him. He was a very brilliant man. The principles that he left with us are worth living on. And also the other interesting principle that we want to do is decolonization project, especially for mental health, so that at least we avoid being over-dependent on aid. We should have our own systems of care that incorporate the Western and the traditional medicine. We should also strive on Boto principle. I'm sure the adage is present in all the cultures that are present within this platform, which stands for a person is a person by and for the people. And also the last one that seems to be overused, but it's still relevant, is prevention is better than cure. We are focusing a lot on mental well-being rather than treating mental illnesses, as it has been the focus for a long time in terms of our mental health program. With that being said, I would like to say that's what Lesotho has for us. Thank you.
Thank you so much, Mkoto. I think where would we have learned all that if we didn't have this session? We really appreciate the presentation. We have really learned a lot, and I think majority of things here, I've seen a couple of people asking for the slides, are things which we can actually try and replicate in other region. I was just impressed by the innovative approaches that Lesotho is taking, the use of traditional leaders. I think I would love to hear from you maybe later on in the question and answer how you're utilizing them. And I would avoid saying hijack, but I think we have the way you have integrated the HIV services and with the mental health service. And I was just curious, and I was also amazed with the fact that the ministry have decided to call unemployment a national disaster. And I think that is one of the things perhaps African countries need to finally come to terms with the reality, because in majority of the research that have been done, I think unemployment has been one of the top causes of mental health. I think initially I was afraid by the budgetary allocation that you had shared with us of 0.1%, but I'm happy that with the data-driven kind of approach, you have said that other ministries have committed 2% of their budget to address mental health crisis, which is quite commendable. And with that, allow me now to invite our final panelists, who will take us through another major issue that is affecting young people, that is the sexual reproductive health rights. And we are happy to have Dr. Tavish to share with us the kind of things affecting young people. Would love to hear what are they doing with the maternal issues with abortion, family planning, the policy they have, and also the HIV crisis among young people. So welcome, Dr. Tavish, and I'm happy and we are glad to have you here.
Thank you, Gideon. So good evening, colleagues and participants. All protocols observed. Can you see my slide?
Not yet.
I can see the slides.
Yeah, you can go ahead, please.
Okay. So it is an honor to be part of this important webinar, to commemorate the International Youth Day, which focuses on the harnessing the demographic dividend and investing in youth SRHR and mental health for a sustainable future. So today I will share with you the Mauritian experience. So basically our context, achievements, persistent challenges, and the way forward in advancing sexual and reproductive health and rights for young people. On this note, I would like to thank ECSA to allow this spotlight on Mauritius. So Mauritius is a small island nation in the Indian Ocean with a population of nearly 1.3 million. And we are a multicultural society, and with good literacy rates, universal health coverage, and a robust public health system, which I would say is free of charge for the population. While we face unique constraints as a small island developing state, we also have opportunities to leverage our size and social cohesion to implement effective youth health programs. So youth aged 10 to 24 make up approximately 20% of our population. Adolescents aged 10 to 19 represent around 13.6% of the population, which is about 178,000 young people. And although our youth proportion is gradually declining due to demographic transition, this represents an opportunity to harness the demographic dividend. If we can ensure young people are healthy, educated, skilled, and empowered to contribute to national development. So talking about youth in the Mauritian context, so I would say that Mauritius has a very strong policy and strategic framework which supports the youth sexual and reproductive health. So we have a national adolescent health strategy 2025-2030 and a national sexual and reproductive health policy 2022, which aligns with the SADC SRHR strategy 2019 and 2030. It also aligns with the Sustainable Development Goals and the Maputo Plan of Action. So basically, we adopt a rights-based, gender-sensitive and multi-sectoral approach, ensuring SRHR is integrated into education, health, youth development, and gender equality agendas. So some of our key achievements in youth SRHR is that we have made notable achievements. Mauritius maintains a low adolescent birth rate, which is 14 per 1,000 girls aged 15 to 19, compared to higher regional average. Comprehensive sexuality education is mainstream in schools. SRHR services are integrated in primary healthcare with 96% of facility coverage, and these include services such as family planning, HIV testing, and even our HPV vaccination program for girls and boys, I would like to add, age 9 to 14 is well established, which contributes to the prevention of cervical cancer. We have also the youth-friendly sexual health services, which are established on campus in 5 tertiary education centers. And these clinics offer mental health assessment, the provision of contraceptives, HIV and STI testing, counseling, as well as the provision of PrEP and PEP. Actually, these youth centers, they act as referral points for other health services. And most importantly, they provide confidential and non-judgmental and accessible spaces staffed by trained medical and community health personnel. I would like to mention that at present, we are having a training of trainers on comprehensive sexuality education. There is a curriculum which has been developed for out-of-school adolescents, and this program is ongoing, started yesterday, and it will end on the 22nd of August. It is in collaboration with UNFPA. So by the end of this training, we'll have a validated curriculum for CSC for out-of-school adolescent and young people. Yet, despite the progress we have made, we face persistent challenges. We have cultural taboos, which continue to limit open discussion on SRHR topics. There are legal barriers where there is third-party authorization or consent needed to access health services. And these, of course, hinder adolescents from accessing these health services, be it for sexual and reproductive health or even mental health. And some rural or even some underserved areas still have gaps in service availability or in service access. And stigma continues to affect the uptake of both mental and SRHR services, particularly among men and marginalized youth. We also face broader SRHR challenges, which includes the increase in HIV cases. There's a rising cases of STI among young people, namely syphilis. And there's also an increase in mental health concerns, which has been linked to social pressures. And there has been the need to address gender-based violence and unhealthy relationships. So there is also the issue of illicit substance abuse, which is unfortunately affecting our society and younger boys, I would say. And addressing this requires sustained investment in prevention, education, and accessible service delivery. So looking ahead, our way forward includes strengthening the CSC for all youth, expanding youth-friendly services to underserved areas, reviewing legal frameworks to improve access, and integrating mental health into all youth health programs. What we aim is to deepen multi-sectoral collaboration between various ministries. So we don't believe in working in silos. So Ministry of Health, Education, Social Services, Ministry of Youth, and also all the civil societies organizations as well as NGOs. So that we want to ensure that no young person is left behind. And by doing so, we can truly harness the demographic dividend for a sustainable and inclusive future. So I would like to thank you for your attention, and Mauritius remains committed to invest in youth, SRHR, and mental health, because we believe that the health and rights of young people are the foundation of our shared future. Thank you.
Thank you so much, Dr. Tavish, for that detailed report on the progress you're making in Mauritius. I would like to just mention to our guest speaker, Dr. Hagos, that we were in Mauritius as young people, together with other mental health coordinators who are seeing here, and also sexual and reproductive health coordinators. And one of the things we came out with in the Mauritius was a framework to address mental health challenge. And we are really looking for a way to also incorporate the sexual and reproductive health issue. So at this point, allow me now to, sorry for everyone for passing, we are way past time, but allow me just to, we add another maybe 10 minutes to just give an opportunity for our young people and also our audience who are here to ask questions. So for any of our audience who has a question, maybe we can take 5 questions, and then we will get maybe final remarks from Dr. Janeth, Dr. Aisha, who will be representing Dr. Janeth. So the floor is open. Anyone with question, feel free to raise your hand and just ask the question. Yes, Mattia.
Thank you so much, Mr. Gideon, for the opportunity to speak. So I want to say thank you to the ECSA team and all the professionals here for giving us this platform as young people to listen and to learn what's going on in other countries. I think mental health is something which is affecting the entire African continent, and if we do not take the lead to collectively see what is working in different parts of the countries that we're in, it won't help us make progress. But as we collaborate like this, it's really great. So Dr. Ntuli mentioned when he was introducing the entire topic about how we have a crisis of mental health issues all around the African continent. And there are certain aspects that I picked out which I think might be useful. When I looked at your research, when you talked about the importance of sexual reproductive health and mental health being part of the collective effort, I really saw it to be truth, because I, being a mental health advocate in Zambia with a mental health body that I run, I have seen that there are certain situations where maybe young people, maybe they have an early pregnancy, premarital pregnancy, and they really become very depressed, and to the point where they call in, maybe seeking for therapy, and they are contemplating suicide because they are maybe, have gotten pregnant early, and they do not know where to access these reproductive services and spaces where they can be taught about if it's abortion services and the risks involved, and also contraceptive methods which are available to prevent such things happening. So it's so important that these two aspects, it's quite unique that we've combined them, sexual reproductive health and mental health, because they're truly interlinked. And if the sexual reproductive health is not really looked into, it will cause mental health issues, and that will also lead to further disasters, like I mentioned, suicidal ideation and whatnot. So it's a good thing that we are talking about this. And therefore, research really plays a pivotal role, even as I conclude. I was reading a research by Dr. Poravi, one of the psychiatrists in Zambia. Like Dr. Francisca mentioned, research will really give us a foundation of what we're dealing with and the prevalence of certain conditions. So in a research that was published in 2017, it was shown that those who are HIV positive 2 to 3 times more likely to have major depressive disorders. And this shows us that this demographic really needs to be assisted, if it's maybe knowing that they can be treated, where to a point where they can't even be able to transmit the viral infection because they're virally suppressed. So education of these people who are in this demographic would be important. So I think research will go a long way. And my question would be, in line with research, is there anything being done maybe at the ECSA team or in our various countries to promote research in terms of maybe capacity building? Like it was mentioned by Dr. Wale that we need to also build capacities on how to do research, how to approach grant writing, because sometimes research can be expensive and young people might not know how to approach it and how to go about it. So I think mentorship programs for research would really go a long way. So if things are already being done, research is being done, then that's great. But if not, I hope something can be done. Thank you.
Thank you so much, Matia, for the question. I think I'll just note them down. Anyone else with a question? Perhaps when you're asking the question, for the interest of time, please just go straight to the question so that we allow as many listeners to ask questions as possible. Is there anyone else with a question? Just raise your hand. Yes, Precious.
Thank you so much for the nice presentations from Dr. Mokutu and Dr. Guinness. One request maybe that I would want to get from Dr. Mokutu, I understand that the whole thing is being recorded. Do you mind sharing the PowerPoint presentation of the slides that you were sharing in? Now, secondly, to the Dr. Guinness from Mauritius, I just wanted to understand, because you did point out in your presentation of the integration of SRHR and the mental health. I just want to understand from the policy perspective, do you have anything in your country with regard to mental health, targeting specifically the youth? Secondly, what is the operation or the current status? Because I understand to say mental health is coming out as an emerging issue due to a number of factors. So maybe if you would share the background to that one so that we appreciate and see how best can we replicate the issues that you are doing in your country. Thank you. I hope I'm clear.
Yes, Precious, you are clear. I think let me take the next 2 questions, and then we will get replies from our panelists. So Kakungu Sikazwe,
Okay, good evening, everyone. I'm really concerned with, I'll go direct to the question. I'm really concerned with the gap that is in between a girl child and a male child. When we look at Zambia, from where I have interacted with a lot of youth, since I'm a teacher, you'll find that we have a lot of organization promoting girl child education, girl child mental health, regarding leaving out the male child. And here we are talking about mental health. Mental health involves both a male and a female. So now, how are we going to work together to bridge this gap of living, instead of leaving out the male child? Should we not involve the male child in our researches, in our promotions, so that each one is moving at the right time, at the right course? I conclude.
Thank you so much, Kakungu. I think let me take the last. I hear that there are two more hands. Mamba Kuena and then Victoria. Please summarize your question.
These are the things we see.
Hello, Gideon. Am I audible?
Yes, you're audible.
Thank you so much. Greetings, everyone. I just want to know how the ECSA is supporting initiatives that make sure that environmental determinants of health, such as pollution that is brought about, issues like poor waste management, climate change, sanitation, and many other determinants are integrated in the deliverance or the execution of efficient care in mental health and sexual, reproductive, and healthcare.
Okay.
Yeah.
Okay. Thank you so much. The last question is from Victoria.
Thank you
Victoria
very
from
much.
Zambia.
Thank you very much. Good afternoon or good evening. My question, first of all, I would love to applaud the Ministry of Health here in Zambia for the efforts. I think they have been so helpful in terms of working with other partners outside the ministry. So my question really is, there is so much, I know Dr. Walia mentioned, of a holistic approach in as much as managing or dealing with the youth, mental health youth situation. My question is there a framework that is meant to sort of manage social media now? I know there's a lot of AI and people are seeking unprofessional help, and that is what is deterring health-seeking behaviors. I don't know if there's a framework that the ministry has or is working on. I think the rest of the panelists can also take this question. How are the other ministries in other countries managing the situation of social media and AI and people using apps like ChatGPT to access help, especially for young people? Thank you.
Okay, thank you so much. Let's now hear from our panelists. I think I'll just give each one 2 minutes. We start with our DG, Dr. Ntuli. So Dr. Ntuli, there are 2 questions which were asked by our listeners. The first one was on research and capacity. Any kind of activities or any plans that ECSA has. And there was also another question by Mamba Kuena on how ECSA is supporting other social determinants of mental health. How is ECSA addressing those 2? Welcome, DG.
Thank you very much. I will start with Mattia. I think we at ECSA right now, we are developing the regional research agenda, which incorporate all the aspect or pillars of research, but also we make sure that we include all the age groups, including the youth. As I said in the previous meeting, that ECSA will be establishing the youth wing. That is pretty soon. So among other things, they will also be carrying out researches in the different thematic areas. So I would like to assure Mattia that sexual and reproductive health and rights. This is one of the areas that will be featured in our regional health agenda. And in terms of capacitation, so having that youth wing or council will be responsible with coordinating and arranging for the capacity building or capacity strengthening workshop, where we will capacitate youth on to carry out the operational research, implementation research, but also we will capacitate the youth with the skills and knowledge for social and the scientific writing. And we will advertise that one in January, where we'll need people to enroll so that we can start that program. With the question that Mabakwena asked, that's also a very important one. So for us, the sexual and reproductive health and the mental health agenda, we take it comprehensively. So we'll rely on the different determinants of mental health, including the issue to do with climate health, climate change, issues to do with commercial determinants of health, issue to do with economic determinants, because what we have seen as the drivers for the mental health disorders among youth, we find from the unemployment, having a high unemployment rate, issues to do with alcoholism or substance abuse. So we address the issue of mental health among youth in a broad way and comprehensively. So we will go from one determinant to the other, including the issue to do with the climate change and other key drivers of mental health. So ECSA Health Community is determined, but we want whatever intervention that we'll be implementing that is focusing on youth, it should be youth-led. And that's why we are coming up with the youth department that will be mainly responsible for leading other youth in the region in implementing both sexual and reproductive health and rights agenda and mental health agenda as well. Maybe to conclude my response is that we will be having a Continental Youth Sexual Reproductive Health Summit between 10th to 12th of November. And that will be hosted in Dar es Salaam, and we will send you out the procedure on how to register yourself and the available scholarship so that we can have a continental representation to that summit. Thank you very much.
Thank you so much, DG, for the answers. I hope they are clear to our listeners. I think let me now move on to the next question, which was addressed to Dr. Tavish. So the question was, how is Mauritius integrating sexual reproductive health with mental health and also the current status of mental health? Maybe you can just briefly summarize answers to those two questions.
Okay, so just to put you in the picture regarding mental health in Mauritius, particularly for the adolescents and young people. So basically, what we have seen is cases of substance abuse or suicidal ideation or attempts, and even cases of depression. These are the most common cases that we are having. And how we manage, I mean, what we have put in place, that is the government of Mauritius, I would say, along with other ministries, is, for example, we have school psychologists in nearly 400 schools and targeting around 180,000 students. There has been the peer support training. So there's a youth health program at the Ministry of Youth. And there are student care and counseling desk in secondary schools. And of course, there's the confidential listening service where we have trained young volunteers. And of course, we have the NGOs, civil society organizations, which are giving a good support to the government programs. and they are providing some form of mental health support. In terms of employment of youth, so we have put forward like two main programs, where there's a youth empowerment program and service to Mauritius. So basically they are employed on a contract basis until they are recruited by either the government or organization. This is for the mental health briefly. Now regarding the integration of mental health in SRHR, so we have been saying that we need to integrate mental health, and the youth clinics is an example of integrating mental health in youth-friendly sexual health services. So we went to the higher education centers, so basically people who are 18 years and older, because of this issue of consent. So with these people, there is no issue of consent. So what we tried, it was a policy decision. So we offered a package. We offered a package to these people. So whenever they were coming, we made that mental health assessment to be compulsory. And then, of course, there was the whole counseling and information session, which was being provided to these young people, HIV testing and provision of contraception. So basically, this service has been really working very well, I must say, and young people has been benefiting from mental health support. So whenever we screen for mental health issues, and I would say the screening is positive, so we can either refer to the psychologist on the campus itself, or we can refer to all our service points. We have different service points in the health system. And what is interesting is that all these services are free of charge. So this is one way that we have integrated mental health in SRHR. And now what we are trying to do, what we have proposed to the government, is to integrate mental health in maternal and child health. So we are coming up with perinatal mental health assessment. So again, this is another way that we are integrating mental health. So I'll end here. Thank you.
Thank you so much, Dr. Tavish, for the response. To conclude the session, let me just hear from Dr. Francisca. There are two questions which I think they are addressed to you. The first one was how to address the issue of mental health for both genders. It seems like a lot of interventions are geared towards the sex, the female and not male. And then the other question was how do we address the issues of unprofessionals or use of AI by young people to deal with their mental health issues? So briefly, maybe 1 or 2 minutes.
Thank you, Gideon. I think when it comes to the sex or gender aspect, I feel it may appear as if more investment is going into the girl child or female child, only because they face special challenges that increase the risk of mental health presentations. I think key within the region is early pregnancies and early marriages, which have been recorded to affect the female population significantly. Hence, you find certain interventions will be specific to females, not to say that the male child is being neglected. Though, in general, the hope is that as a region, we'll prioritize mental health for all, both the male and the female child. And I think it is key that the male child is also mentally healthy because they're within the same community with the female child. I think it's just certain nuances that may lead to more investment being in the female child because of certain risk factors that are being attended to. Then concerning AI, interestingly that this question is brought up, because even in clinical practice, I've noticed a number of the youths, especially adolescents, they'll actually first consult with AI concerning their mental health struggles, relational challenges, rather than fellow youths, peers, or adults around them. I feel there will be need to improve sensitization amongst the youth, especially the adolescents, of the healthy use of AI, the role of AI, and the need for human input and guidance when it comes to relational issues and mental health issues, and how technology can be enhanced or used wisely, but with professional healthcare support. I think that's an area that we will have to be deliberate as a mental health field to invest in when it comes to the youth, especially the adolescents. Thank you for bringing that up. That's, I think, a point of action that we will need to take up.
Thank you so much, Dr. Francesca. I think at this juncture, let me invite Salome to take over. And before that, I really want to appreciate our audience. Let me say, pass special thanks to all our guest speakers, DG, Dr. Hagos, Dr. Francisca, Dr. Tavish, Dr. Thambo. Thank you so much. And I really hope that this will continue this conversation. So Salome.
Thank you, Gideon. Oh, wow. This has been an inspiring and energizing hour, and we have had powerful voices and bold ideas from expertise. Well, thank you very much, the speakers and panelists, for your valuable insights. Now, please, to wrap up our session, I'm excited to welcome Aisha Ali, who is the coordinator of the Commonwealth Youth Health Network, and who will also share the reflections and deliver the closing remarks on behalf of Dr. Janet Mgamba, who is the health advisor from the Commonwealth Secretariat. She was supposed to be here with us, but she was unable to join us. So please, Aisha, the floor is yours.
Thank you so much, Salome, and so much for having me here today. Hi, everyone. My name is Aisha. I am the coordinator of the Commonwealth Youth Health Network, and I will be delivering the closing remarks also on behalf of Dr. Janeth, health advisor at the Commonwealth Secretariat. She was unable to make it due to a last-minute commitment that came up, but she was she was really looking forward to this. And honestly, I'm so grateful that I was able to attend this wonderful session. A bit about myself before I kind of go into how important the discussion we have here really is. So I'm a medical student from Pakistan. I am not someone who is familiar with the ECSA region, the member states that fall under this, because of my health system exposure. I'm really exposed to health systems in the South Asia region, and this was incredibly insightful as to how similar our issues that we see when it comes to mental health, when it comes to financing in the sustainable context for youth-driven solutions really is. In Pakistan, our health financing is 1% of our national budget, and mental health within that is minuscule. So when I heard that statistic of how minute the funding that the project received, I completely understood how difficult it is to make do with minimal resources, but having to advocate for multiple different agencies and advocating cross-sectorally. And this is something which I will say is something incredibly resilient and beautiful about the Global South as a whole. The idea of having to do so much with only being given a little and having to extend these services, as we saw with the rehabilitation programs that were mentioned, as we saw with all of these really, really incredible and innovative youth programs, is making do with the little that you have, and also not only making do with it, but providing impactful solutions which are engaging sectors. One of my favorite things about all of the projects that were discussed today and the insights that were shared was also the focus on sustainability. The training of trainers model was an excellent highlight of that. And it was very refreshing to see how these youth-driven solutions are being impacted across all of these different sectors. And sustainability is also an aspect that is being covered. Because one thing that, you know, I know that all of us who have on-ground experience is if a solution is not sustainable, it will falter and end very, very easily. And so one thing that I would really like to also call upon after this wonderful discussion that we've had is I believe there's always a two-tiered approach to how, you know, it is best for youth advocates and people working in the youth space to approach this. And this is how the Commonwealth really, as the Commonwealth Youth Network, really goes about addressing matters such as this. One is we have our grassroots level advocacy where we're mobilizing our resources, our advocates, we're making the most of our communities. And then second is also the policy component. Very recently at the Commonwealth Health Ministers meeting, the Youth Network delivered an official youth statement to our health ministers on youth inclusive climate health financing. And I think that the Commonwealth Youth Health Network would be a wonderful platform and initiative for all of the youth members that are in this call and people working within youth spaces to join efforts and join our hand in our policy work that we do and help us amplify the voices of the needs of young people across the Commonwealth. One of my favorite phrases within this meeting has been the demographic dividend. The youth are a huge demographic dividend within the Commonwealth. This is an old statistic, so I know we're more than this, but there are 1.2 young people within the Commonwealth. And so that is a huge majority of our global population. And the Commonwealth Youth Health Network, and again, as I speak on behalf of Dr. Janice, the Commonwealth Health Division as well, would love to help facilitate any of these policy processes. If you would like to come together, we can work together on a policy statement, a policy letter, and have that be amplified in our global health governance spaces. And so, you know, just the Commonwealth Youth Health Network is a wonderful platform, and we would love to get involved with all those interested. Thank you so much for having me here and having me close this wonderful, wonderful session. It was a complete privilege to hear from all the panelists. And, you know, a wonderful way to end my youth day here. It's a little late in Pakistan. So thank you so much for a wonderful, wonderful session. Thank you.
Thank you, Aisha. Thank you very much for those thoughtful and inspiring closing remarks. Yeah, so to everyone who joined us today, thank you very much for your engagement and your energy throughout this conversation. And we have had the powerful practical country experiences that demonstrated the real impact on the ground. As Dr. Francisca reminded us that the inclusivity of young people in shaping solutions is absolutely a critical aspect so that we can ensure that achievement of lasting changes in our region. So please, as we prepare to conclude, I kindly ask all the participants to turn on their cameras so that we can capture a group screenshot photo to remember these moments. Yeah, so please turn on your cameras if you're in a position to do that. Chris, I hope you're there. You can help us with the screenshot photo. Yeah, hi everyone. We got a chance to see each other. Thank you. Chris, you there?
Yes, I'm here. I'm waiting for all to turn on their cameras so I can
Okay, great. Just a
capture them.
moment to catch up pictures.
Is it done yet?
Is it done, Chris?
Yes, it's done. Thank you very much.
It's done. Okay, thank you very much. And I wish you all a wonderful evening. Thank you for joining. And as the DG said, please be connected and visit the ECSA website, the ECSA LinkedIn pages, Instagram and Twitter pages, so as to stay updated as we are waiting for the Continental Youth Summit in November. Thank you all, and you have a great evening. Bye.
Excuse me, Salome.
bye-bye.
Just one more thing, colleagues. We have pasted a link for you to give your feedback. It's listed on the chat. So kindly just save some time to click the link and share your feedback. It's very important. We really appreciate for your, so that we can improve our next session. Thank you very much.
Thank you, Chris. As you move out, please do that. Kindly click the link and provide your yes, it's already here. It's already pasted here. So please provide your insights concerning this webinar. By saying that, good evening to you all. Bye-bye.
Bye.
Bye, everyone.
Bye.
Bye.